Hi, welcome back to another video. Today it's a how-to video. I'm going to show you how to inject Sustanon intramuscularly into the thigh. Here we go, Sustanon. As with all our videos, they're for educational and entertainment purposes only. So whenever you start a course of TRT or take any other medicines, always check with your own doctor first. Okay, so today, like I said, we're going to show you how to inject Sustanon into the thigh, or if you want to be posh, the vastus lateralis. Okay, so you can impress your friends with that. Now, medicine comes with its own unique terminology designed to dazzle you.
Your Doppler was negative
for deep venous thrombosis, so there's no need for chronic
anticoagulation or an IVC failure.
So it's kind of like Esperanto, which was a made-up language. Now,
Charvita, Charvita.
Ah, vi parolas Esperanton, Capitano Rimmer.
Come again?
Anyway, back to terminology. So when someone uses jargon, they're trying to impress you or they're trying to justify their huge bill. So it pays to learn a bit of Latin, okay? Now, why do we inject Sustanon intramuscularly? Okay, now Sustanon is a blend of 4 testosterone esters. We've covered this in a previous video. And it's dissolved in an oily base. It's dissolved in arachis oil or peanut oil. So if you're allergic to peanuts or nuts, don't start injecting Sustanon, okay? Now, there's pluses and minuses with intramuscular injection. Now, the downside of an intramuscular injection is we have to reach the muscle, okay? And so we're going to need to use a larger needle. Yes, a larger needle.
Welcome to hell, Min Avenue Medical Plaza.
But the advantages of his intramuscular injections are the muscles have a large blood supply, so the drug is better absorbed. And also we can push more drug into the muscle. In this case, we're going to be putting 1 ml of Sustanon into the thigh. So with regards to the intramuscular injection, from preparation of the Sustanon to the actual injection process, we must try and keep things as sterile as possible and make sure our technique is good. So we're going to show you how to find exactly where to inject. We're going to inject in the vastus lateralis, which is a safe location because it's far away from any major blood vessels or nerves. But we must really be pedantic and make sure that everything is done just to make sure that sterility is maintained. Otherwise, then we run the risk of a painful injection site, formation of abscesses, cellulitis. We can actually cause death of the tissue. So we'll show you all the stages, how to prepare everything in a clean and sterile manner, and the injection technique, how to find the exact location so you don't have to guess or make marks on the body.
All right, tell me what to do.
You'll know exactly where to look based on certain landmarks. So before I show you how to find the exact location on the thigh and we go through the procedure of injection, I'm going to go over quickly how to prepare your Sustanon injection safely and making sure that we keep everything as sterile as possible. So I like to set everything up like this when we start. So everything is to hand, so you're not faffing around. So we've got our alcohol swipes, one for pre-injection, one for post-injection. Then we've got syringe barrel. Here we've got a 1 ml, which makes it easier to inject because if you look at the surface area, it's quite small. So we generate more pressure and it's easier to inject using a 1 ml barrel. You've got let's do the green first. This is what we draw up the Sustanon with. It's a 21 gauge, which means that it's actually the lower we go, the larger diameter. So 21 gauge, the diameter of this needle is 0.8 millimeters. So we're going to use this to actually draw up the Sustanon. Then we have a 23 gauge, which is the blue needle, and this has a diameter of 0.6. This is what we're going to inject in. Then we've got the Sustanon. In the UK, this is how the Sustanon will appear. It's manufactured by Aspen. A good habit to get into is always check the expiry date. And we can see that this is in date. It will go out of date in 2024. Also, because this has been manufactured in Europe, there's two. There's this barcode and there's this QR code. This QR code was made mandatory for manufacturers to put on their medicines if they're produced in Europe. And that was part of a scheme called the FMD, the False Medicines Directive. Now, when this is scanned by a pharmacy or a wholesaler, you get the whole life cycle of this preparation. And it was to prevent counterfeit medicines coming onto the market. And finally, we have our sharp spin. Okay. As these appear in their sealed packaging, they're sterile. So I don't want to take them out of their packaging because then they will become non-sterile. So what I do is I prep everything beforehand, but I will just open the top here and I'll keep the bottom still within the packaging. So this area is still sterile. The same with the needles. Again, so the bottom half is still sterile. The bottom half is still sterile. Also, very important point, always wash your hands beforehand. I've done so, I haven't shown you, it's just a given, but make sure you wash your hands for at least 20 seconds of hand wash before you start prepping anything. Let's go to the Sustanon vial. Right, so here we have this oily vial. Right, so basically, you've got this neck. So there's oil in the top here. So what you need to do, you need to flick it down. Can you see? That's gone. Now, you can see there's a blue dot here. So you want to hold it with your thumb and forefinger with the blue dot facing you. And then you're just going to snap the lid off. Put that in the sharp spin. You put that down. Now you take your needle, syringe barrel, sorry, and you attach the green. So you attach the green 21 gauge needle to that. We try and get syringe barrels with a lure lock, right, so it can attach. You can screw that in, okay? You grab your vial, you hold it at an angle. There's a beveled edge, so you want that beveled edge to go into the corner like that at a slight tilt. And then you want to draw up that Sustanon. There we go. Because it's oily, it takes some time. When you start drawing up air, those bubbles, okay? That means you've taken everything out. Dispose of that, dispose of that. Resheath here. We're not going to resheath once we've injected, but once you've drawn up, you can resheath. Okay. Unscrew that. Get rid of that. Now you screw on the 23 gauge blue needle. You take that out, and what you're going to do is you're going to get rid of the air bubbles. Can you see this bubble here? Gentle tap. There we go. You're going to get a blob appearing at the top when it's primed. There we are. Right, now have a look at the top. There we go. That's all ready now. Then we resheath and we're going to prepare the injection site. So we're going to identify where the vastus lateralis is using this model here. So this is the front of the leg, and on the lateral side, on the side, when we say lateral, just the outer side of the leg, we've got this band of muscle here, okay? and it sits here, and on top of it you've got this iliotubal tract. So we want to inject in a box round about here. Now a good way to find it is you find your groin, hand width down, that's the upper margin of the box, and the knee, hand width up from the knee, that's the lower margin of the box. So anywhere in that region is suitable for injection. Why do we inject here? Why is this such a good place to inject? It's because it's safe. We're not going to hit any large blood vessels, and we're not going to hit any nerves. Now, if I turn this round very carefully, if we take off this, we can see this is a sciatic nerve. Okay, I'll take this one off as well. A bit difficult. Okay, so we've taken the muscles off. Yeah, so this is the sciatic nerve. Now you definitely don't want to be hitting that. And if you look here, if we inject here, there's no chance we're going to hit this nerve here. You're going to have to use one hell of a big needle to hit that nerve. Okay, we're also far away from the left circumflex femoral artery, which is one of the major blood vessels. That's why we choose this area. It's very safe. We're not going to do much damage. Okay, so this is where we're going to inject. So we find this area by looking at the two landmarks. So half a width down from the groin, that's the upper level of the container. Find the knee, half a hand width up. So we have this area here. Okay, so this area here, the vastus lateralis. Another way is to get your palm, start at your thigh, 1, 2, 3. This middle area is safe to inject. So we've attached our injection pad here. Now it goes without saying that, once again, always wash your hands. Okay, so what we're going to do first, we're going to clean this area here with an alcohol wipe. We're going to let that air dry, because if you inject and it's still wet, it can sting. So we have a needle with the Sustanon. We stretch the skin and we come in at 90 degrees. We go in. What we do is we aspirate. So when we aspirate, we want to make sure that there's no blood coming up in the barrel. If there's blood present in the barrel, then that means we've hit a blood vessel. If that happens, take the syringe out, throw it away, start again. Do not carry on injecting. Otherwise, you could inject the steroid ester into the blood. Okay, so we've pulled back. There was a little bubble there. And now we're okay to inject. Okay, when you're finished, get your other alcohol swab, cover, and you're going to throw your needle in the sharps bin straight away. Put some pressure on there. That's it. We're all done. That's it for today's video. I hope you found it useful. I hope it will help you when you inject Sustanon into your vastus lateralis, which we now know means the thigh. I hope it will allow you to gain an appreciation of how to keep everything sterile, the correct injection technique. It gets better with practice. When I first started injecting, it was, I used to dread injecting into my thigh, but now it's better than I first started. I'm not going to lie, it still hurts a little bit, but it's not as bad as before. So what we will cover in further videos, we'll look at different injection sites like the deltoid, the backside. So make sure that you subscribe and hit that bell icon so you'll get the notification when these videos are released. And also, if you haven't done so already, please give us a thumbs up. Okay, that's it for now. Thanks for watching, and I'll see you next time.